Welcome, everybody, and thank you very much for coming. Today, we're here to talk about inactivity, which as you all know, has been a problem that the government has been trying to tackle very actively over the course of the last 15 months. But one of the points that I wanted to sort of emphasize is that when we're talking about inactivity and the need to help people into work, there are also other issues to do with the labour market that we care about. The quality of work, the pay that people get. Far too many people are stuck on low pay in poor quality work. So one of the questions that perhaps we might want to think about is what's the interplay between health, between mental health in particular, between people not being able to work, but also what's the interplay with the quality of work that people are able to secure in the labour market. And the objective, of course, is not just better health and better work, but better lives. And so that's what I'm going to ask each of our panelists to talk about. We're very lucky to have 4 great panelists, 3 of whom are here at the moment. We will be joined by Matthew Taylor, who is Chief Executive of the NHS Confederation and a former head of the Number 10 Policy Unit in the Labour government in the 2000s. But today we've got Izzy Hardman, who is the Assistant Editor of The Spectator and one of the most insightful political commentators that you will find, but also the author of a very recent book in 2023 of the book Fighting for Life, about the history of the NHS and its future. And then we've got Nicola Smith, who is the Director of Policy at the TUC and well-versed in talking about all sorts of issues to do with employment and the labour market. And then we've got Tom Webb, who was the Prime Minister's Special Advisor on health and public service reform until very recently. So, Tom, do you want to kick off?
Yes. I'm very glad this session has started with a kind of more general, as you put, a kind of how do we not only kind of sort the kind of health and activity problem, but the kind of broader lives and getting people into kind of sustainable work that they enjoy. Because I think the biggest risk in this space is to kind of think that there is a kind of a single silver bullet that everyone focuses and targeted in on. And I think when you look back to, you know, there have been other times in relatively recent history where there have been, you know, big labour market questions that have come up. Like, it has taken a kind of a rounded view of what those problems are to really tackle them. When you look at back in the 70s, obviously with women going back into work after having kids, or in the early 2000s with lone parents, really the way to tackle that was to take a kind of holistic look in the round. And so, of course, health and the NHS, which I'm sure we'll get onto, and maybe wait for Matthew to turn up for some of that, is a huge part of that question. And, you know, mental health, especially in young people, take a lot of the kind of the media quite rightly on this, and the kind of huge increase on that. I'm sure we'll get to it in terms of how we talk there, but it's also important we do take a look at the kind of broader system. The benefit system, which, you know, of course has been a big part of the news this year, you know, does need to be looked at in terms of the kind of incentives to getting people back into work. We know that, you know, 1 in 7 people who are, 7 in 10 people who are economically active want to be back in work, and we need to look at how we can best support that. There is then the kind of what are those tailored work, you know, programs to find people the work that they want sustainably, so it's not just kind of forcing them into kind of any job that comes along and making that the kind of the single metric. You then do have the NHS, and kind of access to treatment is a huge issue, and we can talk for a long time on that. But then there is also this other question, which I know the government are looking at the moment, about, you know, in workplace provision. Like, do we need to rethink about you know, how a lot of these you know, problems that people have are actually treated in the workplace to make it more sustainable, that people are staying in work, and, you know, the problems that have obviously kind of risen are being dealt with in a way that back in, as I said, you know, in previous times, we've had to slightly rethink our kind of relationship and role with the careers and that we have.
Okay, thank you very much. Nicola, do you want to give us some opening remarks?
Yeah, sure, and I agree. It is it's a really complex agenda, but it's also a really important agenda, because when we're talking about rising and high levels of economic inactivity, we're talking about hundreds and thousands of people's lives where they aren't fully able to achieve their potential, where people are being left without support, often living on very low incomes, in households with children who are growing up in poverty often. And we're talking about, particularly with young people, opportunities both for them and for wider society that are likely to become entrenched over decades. And that has been described by others as a slow-moving tragedy, and I think it really is an issue that needs to be top of the political agenda. And it's important that we have heard, I think even just yesterday, the Chancellor talk about tackling long-term youth unemployment as a really crucial mission for the government, and I was glad to see that recommendation and that commitment. But look, there's so much to say about this agenda, and I'm sure we'll get into it in the questions. But first of all, it is highly complex. What has been happening with economic inactivity? It has been high and rising. It is now coming down a little. The reason it's been going up is because the number of people flowing on to economically inactive benefits and flowing into economic inactivity, so that's not working or not looking for work, have been going up. It's not because there's been a particular change in the numbers going off. So that really matters. What does that tell us? It tells us that more people are coming from work into economic inactivity, and it tells us that more young people are coming from education into economic inactivity. And it's those two trends that I think we really need to focus the policy on. We know that people who have got lower qualifications are much more likely to become economically inactive. We know that people who live in areas of the country where there are fewer employment opportunities are much more likely to become economically inactive. And we know that where people have got mental ill health, where people have physical ill health, and where that need is not met, they are, of course, much more likely to become economically inactive because of that. And we know that as the population ages, there has been an increase, of course, in the number of people who are of working age but are not in employment or are out of work because of ill health. So there's lots and lots of things going on, and I think simple solutions or simple prescriptions for how to address this challenge and give more people more opportunities need to take account of that full picture. I think there are challenges in how the system has been designed. We've got a benefit system which has effectively said to become meaner and meaner and meaner for a very large number of people, put more and more conditionality in, driven down the living standards of those who are on basic universal credit to a point where people simply cannot live. At the same time, we have got a system for assessing people's capability for work that says, well, you either are capable or you aren't, and is consigning a whole lot of people who are told, well, you're not capable of work, to a group where they are terrified of trying work, of attempting to move into work, don't have support to try to move into work, because there isn't a pathway towards maintaining the support they need to help them with their health and disability and being able to work part-time and see their living standards improve. So there are definite improvements in the system that we also need to make. Conscious of time, but of course, jobs matter, and that's the sort of final opening remark I think I would like to make, because what we have seen is, as I was saying at the beginning, larger flows from work into economic inactivity, but of course we know that those people that work for a larger employer or people who have got higher qualifications and develop ill health are much more likely to stay in work. So ensuring that more of the jobs we have in this country are better paid, more secure jobs where employers are better able and supported to give people the support they need to stay in work is an absolutely crucial part of solving this problem. And of course, it is the jobs where many people with low qualifications are concentrated, which are the lowest paid, which are the lowest skilled, where there has been far less government action to drive up job quality over the last 14 years than we need. Now, the government has got a really important piece of legislation going through Parliament at the moment, still not yet getting to royal assent. Unfortunately, only 1 in 4 of the population even know of its existence, but the Employment Rights Bill is going to make a really big change in terms of what job quality can look like at the bottom end of the labour market. Day one sick pay, right to guaranteed hours contracts, improved access to flexible working. These are all things that can help people stay in jobs and can also help boost labour market participation. If people know that they're going to have secure hours, they can be content that they're going to be treated well if their health condition varies, they know that they can get a pattern that they can flex around their health condition, they're much more likely to be able to move into work as well as to stay in it. So proper enforcement, full delivery of this agenda in a way that actually makes a meaningful difference to the quality of work is also really important to solving the challenge of economic inactivity.
Thank you very much, Nicola. Right, I'm now going to turn to Matthew. Matthew, as I mentioned, is Chief Executive of the NHS Confederation and a former head of the Number 10 Policy Unit, but also was commissioned by Theresa May to do a review into good work in the UK in 2017-18. Matthew.
Yeah, thanks. So I don't really need to amplify on what's already been said on the panel in terms of the scale of this problem and the massive impact it's having on human welfare and on our economy. I think it's also worth saying that we have managed to make progress on this issue in the past. So the government that I advised post-97 inherited the phenomenon really of men over 50, working class men over 50, were very high, very low levels of participation as a consequence of the kind of industrial shakeout of the 80s. And we were able to address that. We were able to significantly raise the participation rates of older men. So we know that we can make progress on this, but it is a national emergency. Sometimes when I'm talking to young people who are kind of interested in policy, I recommend that they listen to a fantastic BBC series called Who Done It. I actually don't think you can get it on Sounds anymore, but and it was presented by Michael Blasson. And what he was interested in was how was it that the UK halved its rate of teenage pregnancy, which nobody thought was going to happen. It was a trend, a bit like the trend we're talking about, which seemed to be inexorable. And like in this area, we were doing slightly worse than most other countries, us and America, very similar. And then the teenage pregnancy rate halved. And the program suggested that it was a combination of at least 4 things. So there was a government program, which principally involved taking young mothers into schools and kind of talking to kind of teenage girls in particular about the fact that they loved their babies, but actually it wasn't a great life and they should think hard about whether or not this was the right choice to make, and all the other interventions in terms of kind of sex education and contraception. So there was government action. It also was at the time of the invention of Facebook. So instead of young people having to go and hang around in bus shelters drinking cider, there was a possibility of staying in their bedrooms and setting up their MySpace pages or doing Facebook or whatever. Thirdly, there was the rollout of long-term contraception, so people could have a contraceptive injection that lasted several months. And fourthly, and fascinatingly, and people under 40 won't know what I'm talking about when I say this, but there was a character in a TV series called Little Britain called Vicky Pollard, and completely unacceptable caricature now, but nevertheless, it contributed to a sense that teen pregnancy was not a very fashionable thing to do. It was a kind of associated with being a word that I would never normally use, but it was used at that stage, chavvy, right? So the idea was it was cultural, it was technological, it was governmental, it was all sorts of things came together, and it caused this tipping point. And what I would say is that when we think about this question of worklessness, we have to similarly think about a multifaceted intervention. And so it will be, and I won't labour these points because they've kind of already been made, but it will be around employment and the quality of work. That is an important part of this. And Charlie Mayfield's producing a report in a few weeks all focused on that, and I think that's going to be an important piece of work. So how do we make sure that the quality of work, people's experience of work, their potential for progression at work, the adaptations made at work when people do fall sick, that we could do a lot better in that area. We need to think about welfare and how we get the right balance of incentives and support. That's not easy to do, but that is the critical thing that we have to get achieve. We have to think about the NHS, the role of the NHS as a service provider, but also the role of the NHS as the biggest employer in many areas. So we do a lot of work in the Confed around routes into work in health and care for refugees, for people leaving the armed forces, for people leaving care. And there's a lot of interest amongst the leaders I represent in doing more of that work. So the role of the NHS as an employer, but also how can we take a bit more responsibility in the NHS for the wider determinants of health? So for example, a great initiative I heard about the other day, which is a GP practice where there is someone from Job Centre based in the practice for much of the week, so that if the GP talks to someone who's in danger of falling out of work or has fallen out of work, they can get that support there and then. So what more can we do in that kind of space? And then finally, without wanting to revert to the crude stereotypes of of a comedy show from 25 years ago, we do need to think about the kind of cultural dimensions of this. People in social housing, more than 50% of people in social housing of working age are workless. In Middlesbrough, 31% of people of working age are workless. So there are communities where this is the norm. And I don't say that in a way of disparaging those communities, but we have to think about how we work with community organisations and voluntary sector organisations so that those communities feel that they have got alternatives to what has become, and again, I'm not using this in a disparaging way, but has become the normal lifestyle for people who feel that there are no better alternatives for them. So we're going to have to do all of these things together if we're going to tackle what is, as I said, a national scandal and a national emergency.
Okay, thank you, Matthew. Izzy?
Thank you, and fascinating to listen to all three of you speaking. Sort of changed my mind about quite a lot of things while I was listening to you, so thank you for that. I think one of the things that I'm really interested in is the way in which the government frames a lot of this stuff. So I think one of the failures of the past year in government has been the way in which the welfare reforms that were proposed and then watered down were really elided with welfare cuts. And so I think, the intelligence of Labour MPs was kind of insulted because most of them are not daft, or they're at least half daft, and they can spot the difference between a cut and a reform. And I think we have this issue again in tackling inactivity, in that reform actually costs a lot of money, and it might save money further down the line. But if you're going to do any kind of reform around welfare, unemployment, young people, you have to invest up front, and you have to invest serious amounts of money. And it's an argument that Ashwin will know a lot more about this than I do, that the Treasury doesn't like that argument. The idea that you might save money in the future, they sort of say, well, you might not. So we need to think about cutting now. And so my kind of big question in terms of the framing that we've seen from Rachel Reeves this week on youth jobs is this a reform that you're going to put the money behind, or is this actually something that you think will save you money quite quickly? Because if you think it's going to save you money quite quickly, then it's not going to work. And previous attempts at doing this have not worked. And then just another point on a different bit of framing, which is around the narrative around young people and mental health. We now have, and we've had a huge pendulum swing over the past few years where, 15 years ago, people didn't really talk about mental health. 10 years ago, people started talking about mental health. I talked quite publicly about having a mental breakdown, actually at Tory conference nearly 10 years ago, which was unrelated to Tory conference, but probably quite a rational decision in the circumstances. But we've now gone from that to sort of it's okay not to be okay. People saying, oh no, but you're talking too much about mental health now. Mental health is becoming sort of too dominant in people's decisions not to go to work. And that's, I think, where we've ended up as a kind of wider societal narrative. We're basically saying young people think they're mentally ill, they're not mentally ill, they're not going to work because they think they're mentally ill, and we need to do something about this and tell them they're not mentally ill. And the thing about pendulum swings is the truth always lies kind of in the middle, and we often overcorrect too far. So it shouldn't really be a surprise that a lot of young people today view mental health as being mental ill health, as being kind of a destination, as opposed to something that you can continue to work while managing, or potentially, as in my case, eventually recover from that mental illness and be able to live a pretty normal, mostly normal life. That young people today don't see it in quite those terms. They see it as, I have a diagnosis, therefore I can't do these things. And I don't think that that's a surprise or something we should blame them for, when we've had waiting lists for mental health treatment, particularly in children and adolescent mental health services, that effectively mean they are being told their mental ill health is a destination because they're not being treated. And so, you might be able to get better from it, sort of notionally, but we're not going to help you. We're not going to give you the counselling or the therapy or the support in order to do that. Coupled with the pandemic, where I think a lot of people's relationships with work, going into work, changed, fundamentally. And I think it's no surprise that we are in this situation where for young people, jobs are not seen as being the sort of inevitability that, even a few generations before always would have considered them. to be. So I don't want us to end up sort of blaming young people for the situation they're in, because obviously we've created that. And then just finally, just back to the idea of getting them into work after 18 months, this big reform, as Matthew said. I was fascinated by your comparison with the teenage pregnancy success, because actually it's one of the few examples where it would be great to be able to sort of thank and herald the people who were responsible for creating a policy environment that they were not in government to see the fruition of. And that's so often the case with policy making, where anything successful tends to be in sort of 10 years' time, by which time these people have, they've been reshuffled like 8 times through jobs, and their party's out of government, and they're now like, I don't know, in the Lords or doing lobbying or something. And they don't actually, most of the time, they don't actually get to be told off for making such a mess of things. But sometimes it would also be nice to actually say, oh yeah, this policy worked, this has been great, well done you. But actually, if we look back to previous iterations of attempts to get young people into jobs, we do end up sort of reheating the same ready meals over and over again. We were talking just before we came on with slightly sort of weary tones about previous attempts at this, including the New Deal. And there were lots of issues with the design of that, which to a certain extent was successful. But you did have a situation where you had a group of sort of quite hard to reach unemployed young people who worked out that actually the reason that whole policy was successful at solving youth unemployment was because definitionally you couldn't be unemployed because you were moved from a category to another category. And so this group of people basically ended up moving from one training course to another training course, not always particularly great quality training courses. We're not talking about someone sort of going on like a Lantra course to learn how to do paving or something like that. It's like how to do interview skills or something like that. Go into another one. They're still in training. It's not actually particularly gainful, but it ticks a lot of boxes. So just in terms of actually evaluating the policy success, we're not going to be able to do that in the next few years. It will be in 10, 15 years, by which time everyone's fled the scene. So that's my
Okay, thank you very much,
thoughts.
Izzy. So some really insightful thoughts. What I'm going to do before we come to all of you for questions, we'll have lots of time for that, is maybe ask if anyone on the panel wants to come back on what each other has said. Nicola, have you got any?
Yeah, I've just got a few points of sort of context that have jumped into my head hearing everyone else's useful contributions. I suppose one thing when we're talking about young people in this debate that I have been saying we need to remember is that there are a very large number of people, too many people in this country, who have moved either from work or from unemployment or from caring responsibilities into economic inactivity where they aren't looking for work or seeking it. Actually, a very small proportion of that total group are young people. The rate at which young people are entering this group is going up. It is a real concern. It's a real concern for those young people's futures, but they are still a very small proportion of the overall group. So I think it's important we sort of keep that context in our head, that the challenges we are seeing of economic inactivity are not in the main challenges of young people, although they are a really important group to get it right for. And I think also for those young people, it's important to think about the very particular context in which this experience has been framed, because the reality is, we've talked about it, but this is a cohort of young people who have been through COVID, who have seen a decimation of youth services, of connections, of Sure Start, of all the things that held on to them when they came out of school without qualifications before. The youth offending teams, all of those who are in the policy environment in the sort of 2000s saw, they don't exist anymore. So they've got both a curriculum which has become more academically rigid and less tailored to the needs of young people who need a vocational route, a school system that has seen, as a result of huge living standards crises, bigger pressures in it, more behavioural challenges, less support in school budgets, yes, youth services available, and then these young people emerge from this system with no qualifications, with a huge opposition to institutions that have made them feel like they are failures, to a system where the Department of Work and Pensions and Job Centre Plus are meant to sort of pick up the pieces and find them jobs. So I think there's a need to sort of recognise that this is a group of young people who have been really badly failed, and there's still a pipeline of them coming through, because much as the government is doing, this problem can't be fixed overnight. So the issue of finding meaningful opportunities for real experience of paid work, which is something the New Deal didn't always do, but the Future Jobs Fund at the end of the last Labour government did do, and which the jobs guarantee that was announced yesterday will hopefully do as well, is really crucial, because I think it's helping people get real experience of paid work with a reference and showing them what you can do, not what you can't do, and not what lots of systems have told you you can't do, that is really important. And final point, just on Matthew's point about culture, I mean, forgive me, but I've got to come back. I mean, a lot of those areas are places where, the issue isn't the culture, the issue is the lack of genuine opportunities, right? We've seen this massive rise in insecure jobs. We've seen areas of the country that have still got very, very few vacancies relative to the number of people seeking them. And we've got support services and, even those sort of soft, early, supportive work coach services, the early access mental health services, the health services that help you get your hip replacement quickly, where they don't exist. So, I think that the rise of pockets of economic inactivity is aligned with rises in economic inequalities in areas of low industrial production, in areas where there aren't enough jobs and where there's very many secure jobs that make people sicker. And those are the issues that we need to tackle. And then I think if we address them, we'll find that people want to take advantage of the opportunities that present themselves.
Thank you for that, Nicola. And I think that's a really interesting debate about traditionally the Department for Work and Pensions, and certainly the approach during the New Deals was that you would solve kind of some of the problems of kind of unemployment and worklessness through support for the people in question to be able to access the labour market themselves, and less about the demand for labour, the kind of the availability of jobs in different areas. Whereas what you're saying is actually there's a labour demand area in parts of the country, and that's actually driving some of what we're seeing in the statistics. So doubtless we'll come back to that point in the discussion. Tom, did you want to come back on any of the points that have been made?
Yeah, I mean, just to really support Isabel's point on the kind of the mental health and framing, like I really do think the way it's discussed at the moment is like unhelpful. And many people talk about the mental health crisis, which is a crisis of access, but it's clearly the increase in mental health struggles, especially in young people, is worrying. But it almost frames this argument, and you see this in kind of public discourse outside of like it almost seeming like a kind of blip that needs to be dealt with in the problem of economic inactivity, where like actually we do need to kind of rethink about how we kind of see mental health. As you said, it's not people go in thinking it's a kind of end state, rather than it's obviously a huge problem, and dealing with kind of mental health treatment is wide. But I do think the way it's kind of framed nationally and how we talk about it, especially with young people, is that something has come along, and it has culturally that's seen this enormous increase, but somehow kind of, that's the problem that needs to be solved. And of course, there are huge issues, and I'm sure many other fringes right now are talking about, the various impacts of social media and other impacts on mental health, and, access remains a huge problem. But we really do need to, slightly rethink, this isn't a blip that's going to go away, and we need to kind of treat the system slightly differently because of it. The other thing, just to note at the very end, is and I say this just coming from government, obviously there's been a recent machinery of government change, which we should acknowledge. They've moved the skills system into DWP, which, obviously with the youth guarantee yesterday, and is probably a first mark of it, but it's an interesting kind of step, obviously, and I know over time, skills gets moved around from where it is, but of course there is a kind of skills element to this as well, which I'm sure we might come back to.
Yes, it was striking when I worked in the DWP on those new deals in the 2000s, how the organisation was culturally opposed to people out of work on benefits spending any time doing significant training, because there was a suspicion that it was a way of getting away from actually getting into work. And so that absence of a skills component in out-of-work support is something that I hope will be addressed by the move of skills into the DWP. But Matthew, do you want to come back? Go on.
I mean, yeah, that's true. And I remember the meetings where there was that incredibly kind of adamantine view from DWP that they weren't interested in anything other than work.
Yes.
But that was in part a response to the point that Isabel's been making about the fact that there was warehousing taking place, of people being put on, tens of thousands of young women, for example, being put on hairdressing entry courses, where you could only get to the point where you could actually become a hairdresser if you took another course which required you to have a maths GCSE, but nobody had actually said to them you need a maths GCSE, so they would do the course and then realise they couldn't get to the next level, which was the level you needed in order to be able to actually do a job without a quality. So there was quite a lot of probably well-meaning warehousing going on. And so DWP's view, which is, hang on, let's just really focus on the job because it's the job, because actually the outcome of a lot of this training was very, very poor. The improvement in employability rates was very poor. And look, you know, I know that when I talk about culture, I can feel myself, again, this is a reference that anyone under 40 won't recognise, but I'm, you know, sound like Peter Lilly or John Redwood at a Tory party conference in the 1980s. I'm really not seeking to blame or to caricature. And it's not about necessarily people who are workless. It's about the culture that pervades places and systems. It's about a culture where, for example, GPs feel that the right thing they can do for somebody is to sign them off, rather than thinking the right thing they can do is to signpost them into ways in which they might be able to get back into work. It's about how you have hope in communities rather than a sense of resignation in communities. So this, I don't want for a moment to suggest that this is to do with a kind of, you know, fecklessness or something. What I'm saying is that, you know, working with community organizations, an important part of that is understanding the ways in which norms get set in communities and the way in which you can shift those norms through a combination of as Nicola says, creating genuine new opportunities, but also shifting the way in which professionals work in those communities so that their focus is more on escaping a situation rather than simply ameliorating it.
Just one other point on work. Your work that you did for Theresa May, you were doing at the same time as Paul Farmer and Dennis Stevenson were producing their mental health at work report. I think in the same year, it was 2018, but either way, they produced this great report for the Theresa May government on mental health at work that showed very clearly the economic costs, not just of mental ill health with people out of the workplace, but of presenteeism, you know, people being at work but too ill to actually do their job, and looked at some of the ways in which employers and government could address this. And I'm not sure we've really moved on. I mean, you know, Theresa May was busy with a lot of other things, and governments since then have been distracted. But I'm not sure we've really taken on board a lot of those lessons from that report. I suspect if that report were replicated today, it would have the same findings about inflexibility, possibly, you know, we're obviously much more mental health aware than we were back then. But I sort of look at the way in which mental health conditions can be or aren't managed within workplaces, and it hasn't changed that much, and it's actually something that's very difficult to get right. So, you know, from my experience, when I first got ill at The Spectator, they were absolutely brilliant with me and gave me, you know, phased returns whenever I'd been ill, extended my sick pay, did sort of keeping in touch stuff, but not in a kind of when are you coming back thing. But to be honest, they did that because I'd been there for quite a while and I was quite valuable to them. And I'm not, you know, I don't think that many employers have the incentives to do that, particularly with new starters, that they did with me. And I'd love for it to be the case everywhere, but I don't think we've cracked that yet, actually, that if you are somebody who is coming back to work after mental ill health, and after physical ill health, actually, you can't just come back with a bang. Often you need a really long phased return, and you might go off sick again, which I did. You know, I often came back way too early because I'm desperate to get back into work and prove I was still alive and all that sort of thing. But I think it's something that needs a huge amount more policy work to help employers, because actually, if I'd been in my early 20s in my first job, I probably would have just been let go, actually, and might have been economically inactive for, you know, quite a long time as a result.
Yeah, I think that's absolutely right, and I think Charlie Mayfield will look at these issues in his, you know, in his report. And I think, in some ways, we disincentivise employers for taking risks with people who might have to say, look, I don't know, and you know. But you're an employer, you take somebody on, and then you feel, hang on, if I don't give them the right support, I'll look like I'm discriminating against them. So how could we work with employers to give them the confidence to feel that they can have workforces that are more diverse in terms of a range of people's needs and the support that they need?
But I mean, I also think it's really good to hear as well that you had a good experience, but there's a sort of reality that for many people, you know, the most basic of expectations that those of us lucky enough to be in professional employment might expect doesn't exist. You know, there are millions of people in this country who don't get any sick pay until they've been sick for 3 years, and then they get, like, you know, around 100 quid a week. You know, the people who don't know from one day to another whether they will be expected to work or not, or who, if they get a WhatsApp on a Saturday night and they turn down a shift for a Sunday morning, will find that they don't have any work anymore. You know, we've spoken over the last year to workers who have had a cancer diagnosis and who have found that because they're on a 0 hours contract, they are to be denied sick pay and simply to find that they aren't to be at work anymore. A care worker who was bitten by a person that she was caring for, who was summarily dismissed on no basis because the employer didn't want to provide any support for her afterwards. So there's a sort of level to which I think we need to recognise for many people, work is not health enhancing, but it's actually it is making health worse. And there are a number of jobs in our economy at the moment that is the case for. And there are also you know, the basic minimum standards of what you would need for a job to support you through ill health. There are a cohort of jobs where those are just simply not being met. Now, there's no immediate magic route to solving that, but I think we need to acknowledge it as the starting point for very many jobs, and then think, what is the balance of, yes, you know, incentives and support for employers to go on a journey of understanding how occupational health can be better, what do good reasonable adjustments look like, but also like a higher playing field of basic minimum treatment, which again, to come back to some of the current legislation, is why it is so important economically as well as for people's living standards. Because if we can't create a jobs market where more people have got more security over their hours, have got, you know, more knowledge that they will know what their working pattern is going to be, that if a shift is cancelled at short notice, they will get compensation for it that is enough to cover the cost they might have incurred, that their job will give them a working pattern that can fit with their health, people are not going to be able to move into work, they're going to be less able to stay in it, and employers that can't manage that basic minimum are not going to be able to manage the occupational health support, the phased returns, the reasonable adjustments that we know are needed, you know, for a working population that is increasingly likely to be working alongside managing a health condition. So I think there's a sort of need to say, you know, the jobs market has changed, our economy has changed, our labour market has changed. We do now need both the higher floor and the higher support, because if we don't get with it, we're not going to see the labour market participation rates we need to see the sort of growth rates that we need.
Okay, thank you very much for that, Nicola. Right, I'm now going to turn to you to ask some questions. So there's a lady here on the left. Thanks, Ellie. Yes, yes. And I'll take groups of questions.
Hi, thanks very much for your...
Could you say who you are and perhaps what, if you represent an organisation as well?
Yep, my name is Ellen Morrison. I'm from the user-led project, the Commission on Social Security. I just wanted to ask the panel if you think the desire to get people into employment is genuine, or if it's more about just simply getting people off of benefits. We've heard a lot, obviously, recently about the nearly 1 million NEETs. 1 in 5 of us is disabled, so we can imagine that a lot of those young people not in education, employment or training will be disabled people too. And Access to Work, the scheme that is administered by the DWP that helps make work and workplaces accessible, we've had no announcements over the past year that this will see greater resourcing or that it will work better. People routinely wait 30 weeks to get an Access to Work assessment. They lose their jobs because employers won't front the costs of making those workplaces accessible. So, yeah, really, do you think it is a genuine desire to get people into employment? Because it strikes me it would make sense to fix those things first before increasing conditionality for young people. Thanks.
Okay, thank you. The gentleman at the front here.
Hi, Henry Anderson from the Health Service Journal. I'm just curious about the NHS and mental health services because it doesn't seem the government, you know, they talk about, the waiting list they talk about is the physical elective waiting list. I think last year the proportion of NHS spend that went on mental health actually fell for the first time in a long time. And so given that a lot of these people who are out of work, you know, will have mental health problems, what does the government really have an answer to kind of fixing those services? Because it doesn't seem like a priority at the moment.
Okay, thank you. I'm going to take one more from this side and then I'll come over to that side in the next round. So the lady at the front.
Hi, I'm Emma Stone. I'm Director of Evidence at a digital inclusion charity called Good Things. So digital is a massive enabler in terms of work, access to work, in terms of access to health, benefits, as well as just life in general. Last year, University of Liverpool and Loughborough University did some research. 4 in 10 households with children fall below something called the minimum digital living standard, which is defined by members of the public around the whole basket of kit, connectivity, also skills and understanding that households need today to feel digitally included. It's great that we have, with the current government, a digital inclusion action plan, but digital inclusion is just a real blind spot still in the data that is being collected, administrative data, and also in terms of things like employability support programs and work that is coming through different departments. So it's just, that's my reflection of a public policy culture that is not joining the dots with digital inclusion, despite us being in this really digital society.
Okay, thanks for that. So we've got 3 questions. One about whether the desire to get people into work is genuine, and particularly drawing the link with the joined up kind of services and particularly access to work. We've got one about NHS and mental health services and mental health spending on mental health services, and one on digital inclusion. Who'd like to have a go? Go on, Nicola.
I can go first. I mean, very briefly on social security, yes, I believe there is a genuine wish to get more young people into work, because it is an absolute tragedy for too many young people's lives if they are starting out at the very beginning of their working lives in your early 20s, in your late teens, and if you don't get real experience of paid work and good qualifications in that early period, all the evidence shows the likely outcomes over years and years and years are a much higher chance of worklessness, much lower incomes, much poorer opportunities for you and your family. So I think it is a real issue of social justice to give as many young people in this country as can work the best opportunities to move into meaningful, secure jobs where they can progress, and to have access in those early years of their start of their careers to good quality experience of paid employment and options which combine learning and earning alongside them. Because I think that's where the discussion has really got us to. We've tried, we tried learning on its own, we've tried earning on its own. We need both to be going alongside each other with far more decent apprenticeship pathways with skills. And yes, a jobs guarantee that gives young people the promise that the government will subsidise employment for those young people who haven't managed to secure it, along with proper support. I hear you want access to work. It is correct, there are very long waiting lists. There is actually, as I understand it, more money going in, but the system is under enormous strain. And so the demand on the system is such that the money that is available is not well spread between people. I think there are actually some questions about employers here and whether some of the access to work money is being used for things that could be covered by some employers within budgets they should be using for reasonable adjustments. How well targeted access to work is, I think, is another question. Very many of the employers that might need to use it most don't make most use of it, and some of the larger employers who maybe are better able to fund it themselves do make good use of it. So I think there's questions about how we target it and make sure it's better available. But there aren't any quick fixes. This is a problem that has been long in the making, and I think we need to recognise that it is positive to have a government that recognises the challenge, and I think is genuinely committed to try to put steps in place that will address it, albeit that there isn't magic solutions to problems that have built up now, over more than a decade.
Okay, thanks, Nicola. Who wants to go next?
Yeah,
Go on.
on the sort of genuine desire, yes, and as far as I can sort of put a window into someone's policy-making soul, but I think there's been a lot of thinking on this for quite a long time, and it's been much more intelligent and sensible than the disability benefit reforms, which were not disability benefit reforms, they were cuts. But I would say that the government is hindering itself, particularly if it wants to have a genuine partnership with the private sector in terms of employment, which is quite important, with its NICS rise. And also, not all employers are, I think it's fair to say, massive fans of the workers' rights package. That there may be disagreements over that, but I think at the start of this government and in the run-up to Labour coming into government, Keir Starmer would talk a lot about partnership with the private sector. And I think the goodwill from business has really sort of drained up the plug hole and really needs to be, well, filled up again, if I'm going to continue this dreadful metaphor, before that could actually be something that would operate. Employers are not in a position at the moment where they're thinking, let's take on lots more people, and that's a real issue.
Tom, did you want to go in?
Yes, I mean, look, on this question about whether it's a genuine desire. It wasn't my area directly, but I feel being adjacent to it in number 10, I do have a small window into the soul of the policy making. Like, I mean, yes is the honest answer. Like, of course, on a kind of social justice level, on a moral basis, like getting people into work is genuinely a desire. It is, of course, looked alongside the system, and when you look at the numbers and the kind of trajectories of where we're getting to in 2030, there is also just an understanding that clearly on a kind of structural level the whole system isn't working. It's going to get extremely expensive, and so I mean, there was a huge problem, as many people on this panel have probably already said, and everyone out there will know, like the handling earlier in this year. Clearly some questions about the kind of framing the arguments put forward and the measures in there, but like ultimately at the end of the day, like there is a genuine desire from the Prime Minister down that there is a problem. People want to work. I mean, it comes back to that. We know 7 in 10 economically inactive want to work. How do we help them do it, both from a kind of social justice, but from a kind of economic point of view as well? So yeah.
Matthew, do you want to
Yes, so passing reference to the third question and then mainly on the second question. In terms of the final question, I absolutely hear what you're saying about digital inclusion. I would say that one of the things that we underestimate in this is design, actually. The vast majority of people have mobile phones and have confidence in using those mobile phones, but they're using apps produced by the private sector that are incredibly intuitive and simple, and the ones that the NHS app is still very, very clunky and needs a lot of development. The Prime Minister is talking today about a massive expansion in virtual outpatients appointments, for example. So the way we design these things, so they're intuitive, so they're user-friendly. So it's not just about kit, it's about inclusive and effective design. On the mental health point, I mean, I think when we talk about mental health, we do need to kind of unbundle what we're talking about. So obviously, for a start, we need to recognize the distinction between mental health and learning disabilities, and actually, in this area of employability, learning disabilities is as big, arguably a bigger issue even than mental health. We're awaiting the government's publication of the ADHD review that it's undertaken, which I think is urgently important, because I think ADHD is a condition which for most people can be treated relatively easily, but people having to wait years. I've seen friends of mine have their life transformed by taking the right medicine, and they're kind of, they were kind of middle-class people with lots of assets, and it still was transformative for their life. So, so that's the first thing. Learning disability we need to think about as well. And mental health, we need a strategy for mental health which is around relatively low-level mental illness, and how it is that we give people relatively simple tools and effective tools to enable them to take control of their lives and move on from those, and not see a deterioration in that. So that's a whole area, and I think there being proactive is important. So the rule of health services is if you wait for people to come to you, you will exacerbate the inverse care law. You'll exacerbate health inequalities. You have to go out and knock on doors. And it's really interesting that in Birmingham, where they have fantastic neighbourhood work in East Birmingham, what they found was that when they went out and they were much more proactive in the community, it reduced GP demand, and it reduced A&E demand, but it increased mental health demand, because what they found was quite a high level of unmet mental health need. Then the second element of mental health is the fact that for a lot of people with long-term conditions, they have both physical and mental health needs. And at the moment, I think we focus too much on kind of physical health issues and not the mental health side. Again, in that same visit to Birmingham, I asked the neighbourhood team, what was the one service they'd like more of to refer people into? And they said befriending. So people were finally getting to the front of a waiting list, getting treated, and then going home and being into a situation of complete social isolation, and then falling into possibly depression, and then back into the service. So a more holistic approach to people with long-term multiple conditions should always bring together physical and mental health. And then there's the very distinct, the different issue of severe mental illness and all the challenges around severe mental illness and people being sent out of area and all of that. So I myself believe we should increase the investment in mental health as a proportion of the NHS, not because I'm a standard bearer for the kind of mental health investment standard, but I actually think if we are going to have a better model of care and we're going to be better at prevention, then we will have to increase investment in mental health.
Okay, thank you. As I promised, it's over to this side now. So there's a lady at the front here.
Thank you very much. Jackie O'Sullivan from MENCAP. I guess, firstly, I think we need to distinguish between learning difficulties and learning disabilities. So a learning disability is, yes, intellectual disability. So, but my question was, last year there was some really interesting research put out by Newton for the County Council Network. And it showed there's a huge spike in the number of kids coming through the system who will transition to adulthood in the next few years, who have been on EHCPs. And there's nothing at the end of it. There's no social care, there's no employment support, there's no interaction between education and services for adults. And that's just a huge waste for them. But it's also a huge waste for their parents because it's quite likely that one parent will have to give up work to support them. And I'd just be really interested in any thoughts you might have around how we can approach that. It really needs a very holistic approach. And I'm not hearing any of that from any of the policy developments at the moment. And there's a real opportunity, isn't there, to bring all of this together. So I'd love your thoughts on that.
Okay, thanks. There's a gentleman on the right, in the middle, who's got a sort of bluish jacket. It's very difficult for me to see precisely. There's a glorious sun reflecting off the Mersey. So apologise if I describe you incorrectly. Go on.
Yeah, my name's Jonathan Bland, and I work with social enterprises in public services and more generally. But I spent quite a bit of time working in Spain in the cooperative movement there, and also with Michel Barnier in the European Commission when he was pushing on social business. I want to come back to your point really about the mindset within DWP and the fact that traditionally it's all about getting people to smarten up a bit and learn a few interview skills and push them into the jobs that are there. And if there aren't any jobs there, or there aren't very many good jobs there, they wash their hands of it. And in other countries, like in Spain, it's actually the employment ministries that take a lead on promoting the social economy and creating really good jobs for people, and sometimes jobs especially geared for people that have got problems getting back into work. And we don't really have that here, and it's not the role of the combined authorities, and it's not really the role of anybody from a government point of view. So is there hope that the DWP could actually take a proactive approach? We've seen things a long time ago in the past, like the Enterprise Allowance Scheme and things like that, where they've supported people to set up in self-employment or small businesses. But I think we're really losing out, and we should change that mindset.
Okay, thank you. And there's a lady just in front there. Thank you.
Oh, hi, I'm Birgit Miller. I'm Cabinet Member for Culture, Heritage and Tourism at Brighton Hove City Council. I've got ADHD and I'm somebody who struggled with mental health quite severely. My question is about the ability of arts, access to arts and sports to provide community. So rather than providing individual befrienders, having the services there that they can go to a community arts class or join a choir, join a musical group, become part of a drama group, dance. That's a way to improve people's mental health. Where is the money for that? Should that be coming from DWP? Because the DCMS hasn't got enough money, but it is something that would transform so many people's lives.
Okay, thank you very much. So we've got 3 questions. One on children with EHCPs and the transition to adulthood. A second one on the DWP mindset, both around job creation more generally and labour demand, and particularly perhaps the social economy. And then a third one on arts and sports access. Who would like to go first?
I'll just so we can all answer one, and then we can maybe have more. I'll take the final point. I think that there's a lot of talk about neighbourhood health. And we would argue very strongly at the Confed that neighbourhood health needs to be around a different model of care and a different relationship with communities. And therefore it needs to be informed by things like asset-based community development. And I've seen good examples of that. And we in the health service have got to get much better at working with the voluntary sector and starting to think about how it is you develop community assets in ways which contribute in exactly the way that you've described. A couple of years ago, I was in Gloucestershire, where they have a reasonably well-developed neighbourhood system, and the practice there was part of the neighbourhood group. They had identified all the people of a certain age who were at risk of frailty but weren't in contact with the health service. And they'd written to them all, invited them into the primary health centre, and had set up a kind of Keep Fit class. many of them are seated Keep Fit class. And within a few weeks, the people themselves had taken that over and were charging £2, and you got a cup of tea and a biscuit, and you did Keep Fit work. So we have got in the health service, if we're going to get neighbourhood working right, work in genuine partnership with people who understand how it is. You develop those kinds of assets and voluntary activities within the community, and absolutely recognise the importance of arts and sport in all of this. I'm an incredibly keen and competitive park runner, which is entirely inappropriate because park run's not a race, but I end up running as fast as I possibly can and doubling up in pain and everyone's staring at me. And park run is the most amazing thing, but it's also achingly middle class. So, how do we take great ideas like that and make sure that they're accessible to the communities that most need them? So I completely agree.
Okay. So don't feel you've got to answer all of them, but who'd like to come in next? Izzy?
Yeah, I mean, just on Parkrun, that's got a social prescribing tie-up with GPs and has done for quite a long time. And I'd say a lot of what you were saying was the job of social prescribers, knowing what's in the community, and also other, as you say, other voluntary organisations or community organisations. I'm on the board of our local community development trust. I live in Scotland. And a lot of what we're trying to do is things like men's sheds and community gardening activities for mental health. So it's working out the sort of local patchwork in the area, I think. And there are, well, certainly in Scotland, there are pots of money available to community groups for these kinds of things. I was really interested in your question on creating jobs, and what sort of jobs are they creating? As in, I think for a lot of voters, when they hear central or local government creating jobs, they think sort of non-jobs involving lanyards. And I just wondered what you meant. I'm not anti-lanyard, by the way. I know everyone here apart from me is wearing one. But
no, it's about actually supporting people to set up viable trading businesses. But it's about doing real things to do that. So in Spain, for example, there's a way of capitalising unemployment benefit to set up a workers' cooperative. There are tax breaks for those cooperatives because they're seen as net generators of good, stable employment. And they do all kinds of things, from kind of manufacturing to services to the food sector. And there are some small examples here, but we could just do so much more. We're missing out, really.
Right. Just my final point, just about skills, and I think it was the point you made, Tom, about it sort of moving around. I just wondered, I guess I wanted to put this to the panel. When has any government really understood and taken seriously skills, apart from the sort of meaningful, we need to take skills seriously? And I know it's partly because a lot of us actually did go through the academic route in school, and I spend a lot of time working in horticulture now, and most of the people I work with in horticulture and landscaping were told at school they were stupid and that they were going to go into a sort of a dead-end job like horticulture, when actually, the gardeners I work with, they train for as long as my friends who I went to university with who were accountants, and arguably have the sort of dexterity of a surgeon in terms of the pruning they're doing.
And with AI, they've got jobs that will still be there in 10 years, unlike accountants.
Robots can't prune roses. But, I mean, the sort of undervaluing of skills within the education system, I think, is a massive issue, where a lot of these people were told that they were not going to amount to much. And just because I got A's at school, I was sort of in some way more successful than them. I just don't think that's fair. I kind of feel like I was lied to a certain extent, and these guys definitely were. So, yeah, just kind of general point, like, when has anyone really understood skills properly?
Tom, do you want to come in on that?
I mean, I genuinely don't know what previous government I would point to. I would say, I mean, just kind of taking Matthew's semi-flippant point on AI, but just with my other hat on, which is in that sector, I mean, there is going to be a huge crisis in graduate-level jobs. I mean, we're already seeing entry-level jobs requiring 2 years' worth of experience. So, obviously things like apprenticeships, which has got the mix and will provide the experience on the job, I think there will be a shift, a cultural shift over the next 5 years, and quite dramatically as the graduate end of that spectrum. I mean, we're not talking about the kind of the plus 55s as well, which is a different thing, but that is something, and I do think that might necessitate a rethink on skills. I mean, just on this point on kind of good jobs, perhaps not to answer the kind of question directly about provision of good jobs and how much, the likelihood of DWP getting involved with that. There has clearly been a shift under this government about the shift from any job to a good job, and there is a realization on many kind of levels, both on well-being but also the kind of keeping people in jobs and sustainability of jobs, that if you want to do that, you need to make people happy in those jobs, and they need to be good long-term jobs, and I do think that is something that will continue.
Okay, Nicola, do you want to come?
I suppose a broad point that maybe speaks to some of what we're discussing. That there's a bit of framing we're discussing around about cost pressures in the system and whether we can afford all of this. And I feel like we need to remind ourselves that we have come off the back of more than a decade of everything being cut and reduced. Look at our social security system. We talked briefly a minute ago about the size of the economic and activity budget. The budgets, for those of us who remember the 2010 budget, huge cuts in entitlements to family incomes, in entitlements to support families with children, in support for people who are living with disability and ill health. That has been embedded over time, and we're now sort of living with the consequences. We've talked on the panel about the consequences of policy decisions. Well, the consequences of a whole lot of policy decisions that have been made by a previous governments are that we have now got decimated public services, which have had years and years of underfunding, and people who can't afford to live. And, we are now seeing what happens. So on your question about, what is the strategy for kids coming out with EHCPs, which are very hard to get, and for supporting them after school, I know there is some good work going on to try and ensure local authorities can track kids who are at highest risk of being NEET. Is there a huge public service offer that's going to be able to be funded and made available to make sure those kids have got meaningfully activity that they can engage in that might move them closer to work? I doubt it, because of some of the huge embedded challenges that have built up over time. It doesn't mean we shouldn't be ambitious and be thinking about it, but we talked about the NICS rise for employers. Nobody wants to see higher taxes on national insurance going up, but at the same time, what was it to pay for? The public services that we're talking about on this panel being so important to ensuring that people can move into work and that we don't see this huge build-up in ill health across the population. So we're sort of living in a time of some pretty tough choices, and I think that means we have to be very clear about our values and about our priorities and be able to stand up the tax rises that may well be necessary in this context to address some of the bigger social and economic challenges that have built up over time, and that if we don't address are only going to become worse.
Okay, thank you for that. I'm going to take two more questions, and I want to take, there's a gentleman in the sort of in the middle on this side. Sorry, around this side, Ellie. So over here, there's a gentleman there. Yes, that's it.
I'm a retired welfare rights officer. I support families with disabled children, carers. I'm very old. The poverty line for me is 3 times the benefit, the poverty line and universal credit for anybody under 25. Is that good?
Okay, so that's a question about kind of whether we, the adequacy of benefits.
Well, about the balance.
Okay.
I have 3 times more money a week to spend than they do.
Okay, and then there's a lady just in front of you, Ali, and then I'm going to stop there for questions, I'm afraid.
Hiya, I'm Elena from the Centre for Ageing Better. I just wanted to pick up on a point that Nicola made earlier, but basically we know that over half of the people that are out of work for inactive because of ill health are actually in the 50 to 64 age bracket. And so we've seen a lot of public discourse around youth unemployment and youth inactivity, and that's well and good because we need to talk about it, but are we not forgetting a bit of the other end of the labour market? Because we know our evidence shows that targeted interventions work best for this age group. And I wonder what the panel thinks about that.
Okay, thank you. So we've got one question on the adequacy of benefits and one question on 50 to 64-year-olds and an economic activity. But can I just, before you come in, but can I also ask you, in answering those questions, perhaps to give us a sort of maybe any concluding thoughts, and then we'll draw to a close, because I believe there's a speech taking place in a while that people might be interested in. So if you could answer those questions and give us any concluding thoughts. Did you want to go first, Matthew?
Yeah, I absolutely take the point from the colleague from the Centre for Ageing Better. I think the idea of young people not working and being scarred for life is one that feels very emotive and very important, but there's a danger that we then forget the fact that this is still predominantly an issue of older workers. I do think in the health service, we need to become better at understanding the importance of keeping people connected to the labour market in terms of their overall well-being. And of course, it is linked to the quality of work and all the other issues that we've talked about. I'll just finish with a bit of kind of good practice. In Sussex, I think, a couple of years ago, they organised a day. They got they invited everyone who was on the musculoskeletal MSK waiting list and invited them in for a day. They had clinicians, they had nurses, they had voluntary sector organisations, they had job centres plus as well. I think by the end of that day, nearly 50% of the people had decided to come off the waiting list because they'd realised that there were other interventions that they could have. They could go to their GP to get a prescription, or that actually the operation was not really going to do them a great deal of good, and what they needed to do was think about how they could adapt their lives. So I think we sometimes in the health service are part of the process of saying to people, you know, you've got a medical diagnosis and therefore you're kind of passive now until such time as the NHS can get round to fixing you. And very often that isn't actually the most effective way to be helping people and dealing with people. My closing point is I've noticed quite a lot over the conference over the last 3 days that people miss the fact that we were talking quite a lot about emissions this year, last year and the year before, certainly from the health perspective. The importance of joining government up in all sorts of ways. We're talking here about work and health. I could talk about the failure to join up between the special educational needs system and the CAMS system. In all sorts of ways, health would benefit enormously from, on the one hand, better joining up in Whitehall, on the other hand, more devolution. So I hope that the government is listening to the fact that many people feel that they shouldn't deprioritise that mission approach as much as it appears to have done over the last period.
That seems a good point to bring you in, Tom.
Yeah, as one of the original co-authors of the mission document, I couldn't agree more. But I mean, on a genuine point, both the kind of horizontal join-up and also the devolution. And for anyone who's in the session before then, I was speaking very passionately on both for this. It's a huge part of the problem. It speaks to many of the answers to the questions out there. I mean, just to agree, of course, like, you know, we can't ignore the older workers in this. And I'm hoping, certainly as part of, you know, again, moving skills across into DWP, kind of, there will be kind of better provision and more thought on that end of it. As a kind of final closing remark, in addition to kind of Stephen Matthews on the focus on missions, I do just think the tone and focus of the debate here today, reflecting with obviously how this came up earlier in the year, is just something that, like, you know, is how when it comes back is where it needs to be. And I think this focus on, you know, back to the question of like, is there a genuine desire to have people in work? That is where we need to kind of really like talk about and not see it from the kind of way it was framed back in the first half of the year.
Okay, thank you very much. Nicola, do you want to go next?
Yes, on the issue of older workers, I completely agree, and I'm particularly interested in the underreporting of unpaid care that I think older women are engaged in this space, and I think it's often just not part of the conversation because there's a huge amount of unpaid social care that's going on that is one of the key factors why labour market participation amongst women, and also probably linked to the rise of mental ill health amongst women in their sort of late 50s, 60s, who are often juggling an enormous amount of unpaid responsibilities at the same time as being encouraged back into paid employment. So I think it's important we understand that challenge properly. Look, my final conclusion would be that we need to think big. what we're talking about today is both big social policy failures that have been unaddressed for a long time in our social care, in our children's mental health services, in the operation of the employment support programmes we are able to offer. Those cannot all be fixed overnight, but we need to keep them in our sights as the actual solutions to some of the problems that we are facing. And in the meantime, we need to focus on what we can do, and we can take action now to drive up the quality of good work and to keep the realities of the huge living standards pressures that everybody is facing central to how we move forward. So let's not make people's living standards any worse. Let's recognise how squeezed they are, and let's do what we can to drive up the quality of work while keeping ourselves focused on those big picture changes that we need to set the framework in place to be able to achieve.
Okay, thank you. And then a final word, Izzy.
Yeah, I think I'd just echo Nicola's point really about the long term and really the need for consistency and holding the nerve as well. I think that is so difficult to do in government. I think this government, you know, it's not had an easy first year. It is already, I think, falling into the temptation of announcing policies to sort of deal with the immediate media and political environment rather than the long-term needs, the long-term issues that this country faces. You know, we do have a number of long-term systemic problems that no government really wants to be the one to have to solve. And it's made much harder when you have political instability, but it's also just made much harder when you have people holding a ministerial post for 18 months, moving on and then taking 6 months to learn the acronyms in their new portfolio before working out what they want to do. So, you know, that's an issue that all governments and all political parties have to face. But if this government is, as we've, I think, agreed, genuinely keen to get people back into work, it really needs to hold its nerve against the temptations to shave bits off funding pots, to chop and change and re-announce things in a slightly different way just to get a few more days good headlines and to hold its nerve and really do the boring work that actually the voters have elected these guys to do on their behalf so they can think about their own lives.
Okay, thank you very much. And thank you for a really insightful and really passionate kind of discussion. And also thank you for your contributions from the audience.